All right, so we're getting ready to perform a PRP microneedling facial on Rochelle today. The first step, after we put some topical numbing on her face, is to draw her blood. Then you need to spin it down in the centrifuge. For 5 minutes. So this evening we're going to be using our NitroNox to make the procedure more comfortable. This is a patient-driven device where the patient or client just kind of breathes in the tube whenever they feel any discomfort, and it helps them disassociate with the pain. It's a 50-50 mixture, and you can drive 8 minutes after your last puff. After 5 minutes, we remove the serum from the centrifuge, and you can see clearly this nice yellow serum. This is what we will be using for the PRP facial. It has platelets, growth factors, pre-subfat cells, and pre-stem cells. Prior to microneedling, it's very important that you really clean the client's face. All right, so we are getting ready to start doing our PRP microneedling. So this is Rochelle's own serum. It's kind of golden, just like honey. All right, so we just lightly glide the microneedle device. We use a skin pen here at Mussel over her face. Let me know if this is uncomfortable, because I'm happy to stop and let you have another puff of your NitroNox. Yes?
Sure.
Good? All right. And you can see here the nice pinpoint bleeding and the erythema. This is the result that we're looking for. Alright, that seems pretty good on this side. So I'm going to stop here again and let you take another puff, and then we'll do the other side. Alright, so we just put some more of this patient's own serum on her face, and we're just lightly going over it with the skin pen. And you can see that nice erythema we're starting to get. That little pinpoint bleeding. There's some pigment from sun damage on the side of her face. The skin pen will help break that pigment up a little bit. We are planning on following this procedure with an IPL. There's the pinpoint bleeding that we're looking for. Alright, I think that looks pretty good on this side. Alright, so you can see here that Rochelle has a little scar. This is a very old scar. I think my sister beat her up when she was little. And the skin pen actually will help a little bit with scars. Now, if they're not really old, it does work better, but it is really nice for scars, and it's really good with ice pick acne scars. So I'm going to make sure that I really go over this area well. Let's just make one more time. Good. Okay, this thin skin under the eye is a hard area to treat. When you have a laser, you can't get this close to the eye and it's a metal shield. So this is one really nice advantage with the skin pen, is that you can get inside the orbital rim. Okay. the other side. Go ahead, you can take another puff. There you go. This is going to end up being a very beautiful treatment. And this can be a little uncomfortable on the lip area. So we're going to take a couple light passes here on the lip first off. If it's too uncomfortable for the patient, sometimes putting a little gauze underneath the upper lip is helpful, like they do at the dental office, just to kind of absorb some of the vibration from the pen. Alright, so before we finish, since these are single-use needle tips, so there's absolutely no reason to send your patient out the door without doing their neck. You know, we put a lot of energy in their faces, and we shouldn't forget the neck, the décolletage, and the hands. Basically, you can run a skin pen anywhere you have skin to help with rejuvenation. And people don't seem to mind the neck quite as much as they do the face. It just kind of whips through the neck pretty quick. And it's a good place to use up the rest of your serum. If you can encourage your patients to stay hydrated prior to you drawing their serum, you'll get more serum. But we always get, 4 to 7 cc's of the serum part. Get out picture.
So how are you feeling after your microneedling with PRP?
Good.
Was the NitroNox helpful?
I think it was. When she first started doing it, the vibrating and the needling kind of startled me. I didn't know what to expect, but I think the nitrix helped that.
On a scale of 1 to 10, what would you rate the pain of the procedure?
Under the lip was probably a 5, and maybe over my skull, a 5, and after that maybe a 2. It didn't hurt really.
Okay.
The numbing cream that they put on prior to it worked.
Mm-hmm. And how's your skin feeling now?
Tight. Very tight.